This is the Illuminate podcast, a Sandy Boy production. Each week on the Illuminate podcast, the hosts will bring you insightful conversations and stories of people who are illuminating their own lives through their business, work, community, family, and world.
Hi, friends. Welcome to the Illuminate podcast. I am one of your hosts, Kristin Srour, and you are listening to episode 68. Today's guest is a woman who holds many titles: social entrepreneur, global health strategist, advocate for women and girls, and the former Miss District of Columbia. Sarah Hillware is a force who has overcome fear to take risks, escaped domestic violence as a child, and is breaking down gender inequality. In today's episode, we talk about equity, equality, intersectionality, how she started an incredible global health organization called Girls Health Ed, and what she is doing now in her role as the Deputy Director of Women in Global Health. Sarah's background, tenacity, passion, and willingness to take risks are all part of her story and have driven her to lead important global change. I hope you love my conversation with Sarah. Sarah, welcome to the Illuminate podcast. I'm really excited to have you here today.
I'm really excited to be here. Thanks so much, Kristin, for having me.
Sarah, you are quite a force in the global health space, and so that's really why I wanted to bring you on. You have done a number of really incredible elements of work throughout your career that I thought that our listeners should hear a lot more about today.
Thanks so much for having me, and I'm just delighted to be here and to be able to share a little bit with your listeners.
Sarah, you are currently the Deputy Director of Women in Global Health.
That's correct. Yes.
But before that, you have had a really fascinating career leading you into that work. So maybe you can tell me a little bit about what you were doing before you came into the Women in Global Health role.
Yeah, so I've had I like to say a non-traditional path, and I really do like to emphasize that, especially for young professionals who often, when they kind of come to me for advice or when they're asking about, how to tell their stories, I think oftentimes people think that they need to follow a specific path. And I always like to just come back to the fact that I did not. So for me, I actually thought I was going to go to medical school. I was pre-med, and I ended up having a couple of transformative experiences that actually led me to global health. One actually was when I ended up leading a medical mission to Ecuador, and we worked alongside local healthcare workers to really provide health education to the community, and also just really listen to the community and find out what their needs were, even if they were outside of the health sector. And so one experience that really struck me was when I was actually working alongside a nurse who was doing HPV screenings, because at the time cervical cancer was the number 2 killer of women in Ecuador. She was talking to a patient in indigenous language in Quechua, and the woman basically told her that the reason that she'd never been for any HPV screenings or really any gynecological visits except for when she had her children is because she had to ask permission from her husband. And she had to essentially, really, I mean, she didn't have agency over her body or over her health. And so, she really did have to get permission to go to see anyone. And she was also forbidden from seeing a male healthcare professional. So, that was one thing. And the second thing was that, if she were to be positive, she would be blamed by her husband. And so she just ended up not going at all. And so that experience for me just really led me to want to work on issues that were outside of the clinic, so to speak. So some of the sociocultural, economic issues that really impacted people's health. And then domestically, I'm actually from Washington, D.C. by way of Louisiana, or should I say from Louisiana by way of Washington, D.C. But the other experience I had was, my mom and my siblings and I actually escaped domestic violence. And that's part of the reason why we ended up moving to Washington, D.C. And then I ended up staying in the area for my studies. But through that experience, I ended up my life completely changed. Went from living in a 4-bedroom home to living in basically a one bedroom apartment with with my family, and and then I ended up living in Southeast Washington, D.C., where the poverty rates were pretty high. And when I went to university, I ended up actually volunteering with an organization called Health Leads in Children's National Medical Center in the Southeast branch, working alongside physicians, working alongside nurses, and medical assistants and other healthcare professionals to really help patients in my neighborhood navigate the healthcare system and also get connected to resources that they needed that were not necessarily health related. So I was helping patients get connected to things like, SNAP, right? Where, they were able to feed their families, or helping them get transportation vouchers to get to and from the hospital, or helping them sign up for health insurance. And so just having these experiences when I was studying, made me actually end up changing my educational focus to global health, where I was able to focus a lot on some of those other factors that ended up making people sick, right? That were outside of, just what you would normally think of as health. And so from there, I was really determined to work in global health when I graduated. I then ended up having an internship at the World Food Program, ended up working there for a little while, then ended up doing consulting work for another UN agency. And then after that, actually, it was pretty hard for me to find a job. I didn't have a ton of experience. I had some experience, but wasn't really yet at the stage where I had a specific focus area. And so I actually ended up working in the private sector for a little over a year, and I actually worked in advertising.
Okay.
Yeah, so I ended up working in advertising. And what that gave me actually was a really great foundation to be able to then use those skills that I learned in advertising about proposal writing, about client management, about communications and marketing, to then get my first job at the World Bank, where I ended up leading communications and stakeholder engagement, and also managing the community of practice for our clean cooking program, which was a cross-cutting program between health, gender, and climate change, and energy as well. And so because I had that private sector experience along with my UN agency experience that I had prior to that, I actually ended up developing a unique skill set that a lot of people who had only worked in multilaterals or who had only worked in nonprofits or government didn't necessarily have. So because I embraced that non-traditional path, I ended up being able to have just some really tangible skills that a lot of my other colleagues didn't come with.
I can see that. That's incredible, Sarah. There's so many things I want to dig into that you just shared. Thanks for sharing about your background and sort of how you ended up in Southeast DC and how that has helped shape your career. Just curious, you jumped in, you took this horrible experience that you had and brought it back to volunteering and to figuring out how to give back to your community. What kind of resources did you feel like you and your family needed after escaping that domestic violence? And what did you feel like the system needed to help support? In what ways did you feel like the system needed to help support you?
Yeah, and those are really great questions. I'm actually really glad you asked that because, one of the things that I found, and, just kind of looking back on the situation is that my mom didn't have as much financial know-how as probably she should have at that point. And I think that when you come from a domestic violence situation, when you come from essentially being in a household with, with two parents and two people kind of managing finances, and then all of a sudden being on your own with three children, that's extremely difficult. So I think, financial literacy would have helped. But I also think that, there were some other factors as well. Housing, that was definitely a challenge. And also for my mom, another thing that was challenging for us is to basically be able to, for her to have a full-time job and be able to afford childcare, because my siblings were very young at the time. They're much younger than me. And so oftentimes, I was the one kind of, looking after them, and when that wasn't possible, then, we would have to find creative arrangements with neighbors or creative arrangements with teachers or whomever, to try to ensure that my siblings were looked after. And so I think, just really the underlying issue was gender inequality, right? Like, there weren't structures in place that permitted my mom as a single mom to have childcare, and to be able to have, access to financial resources and things of that nature. And so, I think it does really come back to ultimately this inequitable system. And I think just really looking back on a lot of the struggles and the challenges that we had, I'm really not sure if we would have had them, if my mom were, instead of being a Black woman, if she were a white man. Right. So, I think, that's part of it. Another part of it is, just really being able to have networks and support systems. Oftentimes domestic violence is really isolating. And so, when we were in those shelters and also transitional homes and things like that, oftentimes, we weren't actually able to, to communicate with family, who were, basically putting us at risk of the abuser, or former abuser finding out where we were. Right. Mm-hmm. So, we didn't have really those connections, with extended family, for a long period of time. Also you can't really have friends over and, things like that. So I think, being able to have a support network is really important. I think a lot of these experiences drive a lot of the work that I do today. And I always approach everything that I do in global health from a gender lens.
But you brought up something really interesting as well on really the intersectionality of inequality, right? Or equality. So it's not just gender.
Right.
There's a lot of other layers to it. And so how do you really address all of those layers so that you can ensure that people have the same opportunities and that they are able to persist after such tragic situations occur?
Yeah, absolutely. And I think there's a difference between the words equity and equality. Mm-hmm. And I firmly believe in equity instead of equality, because when you talk about equality in my mind is when you essentially give everyone the same, right? Mm-hmm. But when you talk about equity, you're essentially giving people what they need to be able to to have the opportunity to reach the same sorts of resources, based on what their barriers are, right? And so you're really creating a more tailored approach versus a one size fits all. Mm-hmm. And I think that's really the difference between that equity and equality.
Yeah, I love the graphics that they have, like at the baseball field, right? So where they have the different kind of steps for, that's typically representing disability, but it's across the different kinds of layers of barriers that exist. And yeah, right. I mean, I think that's such an important piece, is that everybody does start at a different place. And so how do you get there with exactly what a person needs?
Yeah, absolutely.
I was laughing too. So interestingly, my husband also got his career start as an intern at the World Food Program. So there's probably they probably have a whole bank of stories of people who have started changing the world as a result of spending time there. So that's a funny connection.
I love that.
So you eventually went on to start your own organization.
I did, actually. And, I'll tell you, that was also quite a journey, because essentially, Girls Health Ed started from me just wanting to give back to my community. And then I actually ended up, really finding a lot of things that made me angry and uncomfortable. And one of the things that I found was just really profound lack of comprehensive sexuality education in schools. So I ended up doing actually a research project that tied into my thesis. And that thesis actually ended up being the foundation for what Girls Health Ed ultimately became. And so what I found essentially is that there were a lot of organizations focusing on reproductive health or STD prevention, or they were focused on menstruation and at the time very, very few had incorporated menstruation, or they were focused on the nutrition component, or they were focused on kind of the life skills component, or they were focused on gender-based violence or, intimate partner violence. But there were no programs at the time that brought all of those elements together in a comprehensive, holistic way. And so what ended up happening is that, I found this information. It made me angry. It made me uncomfortable. And I just wanted to do something about it. And so I basically, got together my smartest friends, a physician, educator, youth empowerment professionals. And, we essentially just sat down and hashed out over a number of months a pilot curriculum for what would become Girls Health Ed. So essentially, at the time that I founded Girls Health Ed, it was, the HIV and AIDS rates in Washington, D.C. were actually comparable to sub-Saharan Africa, and in some countries in sub-Saharan Africa in particular, was actually, if you looked at just Ward 7 and 8, which were majority Black areas, they were in some cases higher per capita than in some countries in West Africa. And so, what we really did was we wanted to tailor the curriculum to what the burden of disease was, particularly in DC, because that's where we piloted. And then we actually ended up, using a train the trainer model and creating a program called the Teaching Fellow Program, where essentially those who were, basically between 18 to about 30, 35 would get trained in our curriculum and then would be matched with a school or community center to essentially teach the curriculum to a group of girls. And the girls that we serve are ages 8 to 18. And so fast forward to today, we ended up essentially scaling the curriculum to reach 5,000 girls. We're now in Washington, D.C., we're in New York, we're in Los Angeles and New Orleans. We're also in Kenya and about 4 areas in Kenya. And we have a pilot in Bangladesh and also at the beginning stages of a pilot in India. And so, one of the things that's really unique about Girls Health Ed is that, yes, the Teaching Fellow Program, but also that the curriculum itself, I think a lot of people, especially in the United States, assume, and not just the United States, a lot of high income countries assume that the issues that girls and that people in general face in high income countries are vastly different from the issues in LMICs, which oftentimes, especially if you look at intersectional inequality, is not the case. Because oftentimes, when you actually do look at, minority health in the United States and in other high income settings, then you essentially, depending on where you are, have similar barriers that those populations face as you would a lower middle income country. And actually, I was just listening to Winnie Byanyima speak, the head of UNAIDS, the other day. She was on a panel that I was co-moderating, and she said a Black child born in the United States is more likely to die before their first birthday than a child born in Libya.
Wow.
Yeah. And so, but it's because of that reality that Girls Health Ed has essentially tailored our curriculum to be able to be adapted to any resource setting. And essentially what we do, kind of going back to that issue of equity and really tailoring solutions, is we listen to the girls, listen to the healthcare professionals, listen to the educators, and we learn about what are the burdens of disease in that particular area who has requested the program. And then we tailor the modules to essentially meet the needs of the community. And then the teaching fellows that we train are from those communities that essentially are being served. You know, with Girls Health Ed, I really do see it as quite revolutionary, because comprehensive health and sexuality education has the potential to really change social norms. You know, we talk about things like FGM. We tackle things like consent. We talk about, why is menstruation happening in the body, and normalize it and normalize that conversation. And I'll just give a quick example before I kind of pause. Is in one of our courses, or essentially in one of our groups, there was a girl who was being bullied by a group of boys about her period. And then a girl who had actually been through our workshops ended up stopping the bullying in its tracks. And she actually used what she learned in the Girls Health Ed workshop to educate the boys about what periods are. And the boys stopped making fun of the girl. And so, I think it just shows how powerful, education is, and particularly comprehensive sexuality education, to really changing social norms and creating healthier school and community environments for girls to enable gender equality.
Mm-hmm. That's amazing. I mean, and at the end of the day, right, like, okay, we're all women. We all need this same education knowledge. It doesn't matter whether you're a woman in Bangladesh or in Kenya or in Washington, D.C. It's the same thing are happening to our bodies, right? Right. So I do think that, and your approach of, how do you tailor those solutions? How do you work with educators within the community to understand the cultural context or the stigma? I mean, I know some of the work that I do, like having a menstrual cycle is culturally thought of as you're impure, or that you
exactly
maybe had sex before marriage, or there's all of these false beliefs around it. And so you're absolutely right. We have to normalize that conversation. And this is the normalization of it certainly requires those tailored community solutions and local educators to help deliver it. But the knowledge for everybody to have is the same. So it does make sense to me that you're in New York and DC and LA and Kenya and Bangladesh and India. I mean, in terms of that knowledge, and that's just really remarkable.
And you know what? A lot of the girls that we serve in the United States, they're Black and brown girls. A lot of them come from immigrant communities, or, especially in Los Angeles, we have a lot of Asian American girls and a lot of Latinx girls. And so oftentimes they are actually girls, who are from communities. We've had Somali girls, and we've had girls who come from Kenya. So oftentimes, they are actually from similar communities and have similar issues, just like you said. And probably one of the most important things about Girls Health Ed is that, so yes, of course, we're, serving girls 8 to 18, but the young professionals, the young women between ages 18 and 30 or 35, those young women are taking what they learn and what they experience through working with girls in Girls Health Ed, and they're taking it to larger organizations that they're a part of. We have teaching fellows who are, working at Pathfinder and PSI and multilateral agencies, and they're taking what they learn in the community to their work in public health, or to their work in education, or to their work in government. We also have had some teaching fellows who've taken that path. So for us, it's really important that our teaching fellows also start to understand some of these issues and also really start to break down some of those, very, very colonial outlooks on global health, and really seeing, populations that they're working with as the other, or seeing them as vulnerable, but really, really understanding that, what we're doing in global public health is, we are providing tools, but these girls and these women, they're already powerful. It's just our job, to essentially listen to them and help them, to be able to harness that, that power that they already have, right? We're not in a way kind of giving anything, and we shouldn't be prescribing or assuming, but we should always be listening. And so that's what I hope that teaching fellows who work with girls health ed are able to take to their careers, is this, really this humility and this idea of always listening, to girls and listening to women around the world, that they are, trying to provide tools and resources for.
Mm-hmm. Oh, you just said so many important things. First of all, we should always be listening. I just want to pause for that. I think that is so important, and we should do that in so many ways in our community. And I think it is one big step towards that equity, right? We should be listening. And they are already powerful. You're right. These girls are already powerful. And sometimes just equipping the tools so that they can harness that power and feel confident about it is all that's really needed, right?
Yeah. Absolutely. And I think it's also the same with, this, I've been hearing sometimes, and I think it's being said less and less, because people are realizing that it's not accurate, but, giving a voice to the voiceless, or, that's not what we're doing. We're just elevating the voices, that are already speaking, right? But they just need to be heard, right? They need to have a seat at the table, and they need to be taken seriously. And that actually brings me to what the work that I do now. So with Girls Health Ed, I'm a proud board member. I'm actually chair of the board. But we now have a really great new executive director named Pavita. And she's just so wonderful. She's been with the organization for more than 6 years. And, she's moved from being program director to now leading. And, she's doing such a great job. And I'm really proud that I was able to pass the baton, so to speak. And the work that I do now is with women in global health. And so, some of those experiences that I talked about before in Ecuador, in Southeast Washington, and with Girls Health Ed, that really led me to want to work on issues of gender equity within global health. Because one of the things that I found, and I'll just talk about World Food Program for a second. I remember, just sitting around the table, and, I was in a meeting at the World Food Program, and, of course I was very junior, but, I was sitting around in a meeting and sitting around the table, and, there oftentimes, there were a lot of men, not a lot of women. Mm-hmm. And there were conversations that I remember being had, conversations about girls, about women, and, maternal and child health. And there was one campaign that I worked on called the 1,000 Days campaign, which essentially, about the nutritional needs that a child has, during his or her first 1,000 days of life, and also the nutritional needs of the mother. And so, I just remember sitting around a table and just really like being so shocked that there were just things that I would think were obvious as a woman, that men were just completely overlooking, and I just remember one time just kind of interjecting and, saying, by the way, did you think of this? and sometimes it seemed like they hadn't. And why? Because there weren't enough women who were actually at the table, who had lived experiences to be able to, to have input and make decisions. And so at Women in Global Health, our mission is really about, it's verbatim, challenging power and privilege for gender equity in health. And so what we're really about is ensuring that women have a seat at the table, and that we are able to achieve gender parity in all aspects of health. And in particular, in the health sector, girls, or not girls, but women in particular of working age are 70% of the health workforce. Most of them are actually in low paid and low status roles. So, they're nurses, they're midwives, they're, really in these roles that are at the front lines. But in a field where it's 70% women, who are the ones doing the work, it's only a quarter of women who are actually in leadership positions.
That's crazy.
Yeah. And it's also something that I noticed, as I kind of moved up the career ladder, I noticed that there were fewer and fewer women, while in my public health courses, there were plenty of women. Right. So, it just didn't make sense to me. The dichotomy was really stark. And as I had kind of described to you already, I had already experienced that, in a lot of rooms that I was in, and, tables that I sat at, that there just weren't enough women, and that actually weakened the effectiveness of programs. And so the work that we do at Women in Global Health is really focused on getting women into leadership positions, and also how do we create the enabling environments for them to stay in these leadership positions? How do we ensure that they're supported, that they have paid leave, that they have childcare, that they're also once they get to the table, that they actually have a say. And that it's not just window dressing, but that it's meaningful engagement. Mm-hmm. And then also looking at, not just gender, but also the intersectional aspects, right? How do we ensure that, that the women at the table are not just white women? How do we ensure that women from minority communities and high income countries, or, especially low and middle income country women, are at the table, who are actually from, the places that, we're designing programs, for. So, and that's the other thing. So only 5% of, women, who are in leadership roles in global health, are from a low or middle income country. And so the disparity gets even worse, when you start to look at those intersectional barriers. So that's part of the work that we're doing. We're also looking at safe and decent working conditions for health workers, because we know that they are, majority women, that they're facing harassment. Oftentimes, personal protective equipment doesn't fit. They're also, facing many other barriers as well, to leadership, even within, those roles, those clinical roles. We're also looking at the issue of unpaid work in health. Community health workers, for instance, are oftentimes unpaid or stipend based. And we know that community health workers are a majority women as well. And in some contexts, 90% of community health workers are women. And so essentially right now, global health is resting on the backs of poor women around the world. And this is the reality that needs to change. And so that's the work that we're doing at Women in Global Health. We really try to bring local reality to country level and global level decision making, through gender equality. And I think just, from the experiences that I've had, that's really what's needed. That's really exactly what global health needs to be: more equitable, to be much more effective, and to really have the impact that we're trying to achieve. And I always say, without gender equality, without gender equity, to be more specific, we'll never achieve health for all. Because health for all means that we actually have a system that works for everybody. And right now, that's not the case, and will never be the case unless we actually have equal representation in leadership to ensure that we will have a system that reflects the populations that it's trying to serve.
Mm-hmm. Yeah, well, as a woman who works in global health, I'm thankful to have you leading some of these conversations and thought process. And I totally agree. I mean, you're talking about an enabling environment, and I was actually, as you were saying that, thinking back to how some of the descriptions of the enabling environments that you're advocating for and trying to create, I actually was thinking back to your mom and how having those for her was so important for her to advance and to support her 3 children, and the equal representation. I mean, when you think about that 70% of the workforce being women, and then how misrepresented they are in the leadership, and then also, I mean, creating solutions, creating programming, you can't solve a problem without the people that are facing it, right? You can't without them at the table, without their voice, without, them helping lead the solutions around it. And you're right. I think for so long that representation just really hasn't been there in the way that it needed to be to really get to, how do you create a sustainable solution? Yeah. So I think that work is really, really important. And I'm so happy that you're one of those people that's leading it, because you bring such a breadth of experience and knowledge and power to the conversations that are happening. So thank you for the work that you're doing.
Thank you so much, Kristin. But I just want to point out that it's not about me. It's not about those of us who who are in the global secretariat, but it's also about our chapters. Who are the women who are leading the grassroots movement for women in global health and on behalf of these issues that I just mentioned, who are around the world. So we have about 24 chapters, and about half of them are based in low or middle income countries. And so Women in Global Health is a movement that's about 35,000 supporters strong. And it's led actually by women who are volunteers, who are taking these issues on in their countries, and they're really building up communities and networks to tackle these challenges. And so, I'll just kind of talk a little bit about one of our chapters that's actually in Zambia. So it's a brand new chapter, but I'm just really amazed at what they were able to do recently. And so they actually had a meet and greet where they actually brought together several NGOs. They brought together ministries. And so they actually brought together someone at the director level in the Ministry of Gender, and also some representatives from the Ministry of Health. And so when the Ministry of Gender was presenting at this meet and greet, which I was able to call into, the Ministry of Gender, the representative was really just talking about how the ministry just doesn't get the funding or attention or agency that it really needs at the national level to be able to drive change. And as she was presenting on so many of the issues that girls are facing, especially that are being exacerbated during COVID-19, like gender-based violence, like increased pregnancy because of decreased access to contraceptives, and an increased rape and things like that. She was saying that essentially because the ministry is not able to essentially sit at an equal table with the Ministry of Health and the Ministry of Education. That's part of the reason why some of these issues were not able to be addressed in the way that they really should be, which is in a cross-sectoral way. And so it was just such an amazing thing to see the Women in Global Health chapter being able to kind of facilitate these dialogues between and among ministries, because now that the Ministry of Health has heard the Ministry of Gender talk about these issues, now they can take the issues that they're working on in the Ministry of Health and approach them with a gender lens, right? And otherwise, those ministries might not have had that chance to really have that open dialogue that was driven by the Women in Global Health chapter. And so, I just think that our chapters around the world are just doing such amazing work, and I think from where I sit, I'm just happy to support them in any way that I can. because this is really the work that needs to happen. It's not just about what we're doing at the global level, but it's also about what our chapters are doing at the country level. And we just really want to, to elevate their voices and support them as much as we possibly can.
That's awesome. That's a great story. And you wouldn't even think that the government needs all this help to sort of make those connections, right? To figure out how you work across the sectors. Sometimes having that, external group bringing it, all the pieces together and having that lens on it is incredibly helpful. So that's a great story about the work that you all are doing.
And I wouldn't even call it help. Sometimes it's just, it's just about a civil society organization, who represents, essentially the voice of the people, right?
Mm-hmm.
And I think sometimes that external pressure is just the catalyst that's needed to drive change. And just from having started, a civil society organization to having, worked in a couple, I didn't even mention the nonprofits that I also worked in, here in the U.S. and globally, before. But just having worked in nonprofits and in CSOs, I can just say that, the power of organizations that are truly people driven and people led is just truly phenomenal. And I think we're just starting to tap into the power of CSOs.
Mm-hmm. Catalyst. That's a great word for it. Okay. So 2 fun things. So first of all, you were Miss District of Columbia.
Oh, you dug that up.
It does show up on the internet. And so I just have to know more about this.
Yeah, sure. So I ended up competing for Miss DC because there were actually kind of 3 times that I competed, and I'll tell you a funny story about each of them. So the first time I ever competed was when a board member of the Miss DC, which was the state affiliate for the Miss America pageant. Okay. She actually ended up finding me on Facebook, and she had mistaken me for a contestant that year. And I said, that's quite flattering, but I'm not the person that you're looking for. And she said, well, that's okay, because we're still accepting applications for contestants. And so I really think you should apply. And I talked to some people I trusted, and I said, I never really saw myself as a pageant type. I was always
and how old were you?
Oh my goodness. I was in my 3rd year of undergrad. Okay. And so at the time, I was like, not even thinking about this. And so my friends encouraged me to do it. So I ended up doing it. I ended up competing that year, and I didn't end up winning, but I ended up getting an award. And essentially I was actually approached a second time after that, and I wasn't planning on competing again. I said, okay, you know what? That was a fun experience. Great. Don't need to do that again. But I ended up being approached a second time, and I ended up competing in a different pageant, but for the same title for the America's Miss District of Columbia, and I ended up winning the state title that year, and then essentially had a blast with it. I thought it was just such a great opportunity because it helped me get things like speaking appearances and really talk about the issues I cared about. And at that time, I was kind of at the beginning stages of starting Girls Health Ed. And so it did allow me to be able to meet some great people, who could support Girls Health Ed and what we were starting. And also I got to meet some pretty cool people. I got to meet President Barack Obama, and First Lady Michelle Obama. I also got to meet the President-elect Joe Biden and Dr. Jill Biden, second, now soon to be First Lady, but at the time Second Lady. And so it afforded me some really cool experiences, and I think through being America's Miss DC, I was also able to, to do things like talk to school kids in the community about self-confidence and about body image and, about, overcoming some of the challenges that they were facing that I had also faced. And so, so I think it gave me a platform to be able to do some of the community work that I really wanted to be able to give back, and to also be able to launch Girls Health Ed, in a way that was impactful. So it was a fun experience, and wouldn't trade it for the world.
That's awesome. Thanks for sharing that. And then you also had another unique experience. So you launched an app called She Wins.
I did.
Okay, tell me a little bit about this, because this led you to Shark Tank. Is that right?
Yes.
Okay,
yes,
I need to know more about this too.
I almost forgot about that. And you do your research. So who knows? I ended up in 2014 getting together with two good friends of mine who are both doing the Master Public Health Program at GW, and one of my friends had actually wanted us to apply for this business plan competition at the university. And she said, I think it's a great opportunity. And we had been talking about essentially doing something that would benefit millennial women on campus. Because, I had talked to them about Girls Health Ed. I talked to them about the lack of information that I had experienced, kind of just about my body, as a girl and then as a young woman. And we said, well, what if we were able to create a tool, and create a platform where millennial women could get information about their sexual and reproductive health, and actually talk to healthcare professionals anonymously through an app. And so,
this is like telehealth before telehealth was really a thing, right?
Exactly. So, these terms were kind of thrown around, and there were some, folks working on it, but it wasn't as widespread as it is now. And so, we at the time, we all had public health backgrounds, but none of us were clinicians. And, one of the co-founders actually did end up going to med school later. But we were really just thinking about how to monetize it and how to, make it sustainable and viable. But then also how to ensure that it was something that followed HIPAA compliance, because that was, a really big challenge for us, is really ensuring that we were able to provide this innovative service, but also ensure that it was compliant with, a lot of these regulations that, just weren't built for systems like this. And so, we had some challenges, I would say, just kind of ensuring that we could build something that didn't meet all these requirements, and that also was able to be profitable. So we actually ended up, doing quite a few customer surveys. We ended up, drawing up some wireframes. We also ended up putting together, a business plan where we would essentially have health insurers and have, healthcare professionals who were in private practice advertise, about their services on the app. We also wanted to have advertisements from drug companies. We thought that might be a way to monetize without selling patients' data, because that was against HIPAA compliance. But then we were like, well, how do we pay the healthcare providers who are going to be providing information, anonymously, and also how do we ensure that they're comfortable signing up? Because of course, when you provide information, then all of a sudden you're exposed to liability, right? So we had to ensure that it was something that the healthcare providers felt comfortable signing up for. Mm-hmm. And so, we ended up, finding some solutions to some of these challenges. But ultimately, we ended up kind of, persisting for a while. We ended up pitching to Shark Tank. We ended up making it to the final round of Shark Tank up until the point where we got like 100-page stack of paperwork to apply before we actually were gonna be in that next round where you'd essentially go on air. And we ended up saying no. We ended up not wanting to do it. Shark Tank actually ended up having a ton of really just kind of shady clauses that we had to sign about, potentially, not having full ownership of our IP. And, basically if there's a deal that's made on the show that you might not be able, that might not be reflective of the actual deal that's made. And, we didn't feel comfortable kind of moving to that stage without having some of those other questions answered that I just talked about. Mm-hmm. So it did end up making to the finalists. We did end up saying no. And then we continued to work on She Wins. But, ultimately, money was just a big challenge for us because, to build something that was going to be compliant, and was also going to be able to meet a lot of the requirements that were necessary. We just needed a lot more capital than we were able to raise. But I always say that having tried something and failed is so much better than not having tried at all. So I'm just so grateful to have been able to work with such incredible women. I'm proud to say that we were all women of color. One of my co-founders was Iranian American, another was Pakistani American. And we were just such a girl power team. And I'm really delighted to have been able to work with them and to have had that experience. And who knows, maybe someday I'll be a co-founder of some other type of app or health platform again in the future.
Well, that's awesome. And I feel like, the way you described it, there's clearly a lot of things you learned that from launching that you've taken forward with you in your career, and you should be really proud of it. It doesn't sound like a failure to me, but I hear what you're saying about it didn't kind of ultimately come to fruition. But that's really, thanks for sharing that story.
Yeah, and I always say since then I've been able to have judged some startup competitions and and pitches and things like that. And I always say, oftentimes it's not your first idea. That's the one that ultimately makes it. Oftentimes, it's maybe your second or third idea, and it is really entrepreneurship, and especially social entrepreneurship is all about listening, and it's all about learning. And I think just one kind of, to bring it back to that one point, the thing that we did the most was listen. We listened to our, base of customers, or potential customers. We really listened to healthcare providers, who we wanted to join. We also, tried our best to listen to, to those who were our mentors and advisors who gave us feedback. And I think that's just really part of any journey is learning how to listen. And I'm still trying to, just continue to learn how to be a better listener.
That's awesome. Sarah, you have had such an incredible career, and you're doing really, really important work. And I really appreciate you sharing your journey so far. I can't wait to see and follow you and see where you go and how you transform the global health space and beyond. So thanks so much for being here today with me.
Oh, thank you so much, Kristin. It's been such a pleasure. And I look forward to staying in touch and to being able to hear from you as well, and the work that you're doing. Because I think that, we as women, we all need to support each other and also build our own, girls network. So,
yes.
So looking forward to being in touch and, supporting you however I can.
Thanks. And we, in the show notes, I will tag and put links to all of your work so that our listeners can go learn more about that. I just want to bring you to now our end of podcast questions. Mm-hmm. So my first question is, you represent somebody who illuminates in your life and in your community and your work. Who's somebody who illuminates for you?
Does the person need to be dead or alive?
Either. It doesn't matter. Somebody who just you think has or had illuminated in their life.
Yeah, that's a good question. I actually have three women who I'd like to highlight. So the first is, of course, my mom. I think she showed tremendous strength and resilience, through a lot of the challenges that she's faced. So she's definitely somebody who illuminates, and I see her as a source of strength and inspiration. The second person I would say is Maya Angelou. I was really sad that I never got to meet her before she passed. But, as somebody who has used poetry and has used writing as a way to heal, I think she's just such a light. And, when I listen to some of her pieces, sometimes, I just cry because I think she's just so amazing. And she'll live on forever, and so she's definitely somebody that I've always looked up to and admired. And then third, I would say Kamala Harris. I have followed her since she became California's Attorney General. I followed her Senate race, and then of course now she's VP elect. I followed her throughout her campaign, and I just have to say, I mean, she's just so graceful, and she's somebody who always carries her head high. And despite the vicious attacks that she's had, throughout her career, she just stays above it all. And I think somebody like her, somebody she just keeps laughing, and she just keeps smiling, and she keeps dancing, regardless of these things that she's been through, and the things that people say about her. And I think that's just so admirable. She's a teacher of joy. And I'm really looking forward to seeing what she'll achieve in this, in these next 4 and hopefully 8 years.
Yeah. Oh man, all three of those women, so incredible.
Oh yeah.
Give me a book recommendation.
Yeah. So the book I always recommend, or that I recommend for people who are interested in gender equality, in particular gender equality in health, is Half the Sky. And I'm always shocked when people tell me that they haven't read it, because I'm like, you have to read this book.
It's so good. I totally agree. Yes.
And I think especially if you work in gender equality and or global health, and it's by Nick Kristof and Cheryl Wu Dunn, and they're a husband and wife duo, and I think Nick Kristof, so he's of course a New York Times author, and journalist, and Cheryl Wu Dunn, is a businesswoman, I believe. But they just did such a great job illuminating the stories. Speaking of Illuminate, illuminating the stories of women around the world, and really also driving that point home that women, no matter where they are, they face very similar structural challenges. And so that book, I think, is just super educational, and it's also inspiring. I just think it's so well done. And then a second book recommendation, I love this book called The Subtle Art of Not Giving a Fuck. Such a great book. Don't let the title scare you away. And I'm normally not a person to use profanity, but this book is just so excellent, because it really talks about how we get in our own way, and how we can essentially stop caring so much about what other people think, and also about what our fears are, and we can essentially just care more about things that are important to us. So it's essentially about choosing where to care, right? Like where, choosing in your life where to give a fuck. And I think the underlying thesis is like, we can't care about everything. And among those things we shouldn't care about is, what people think. And, we shouldn't care so much about failing, because ultimately what we should care about are the things that are important to us, and what's important to us, ultimately, even if we are afraid, overcomes those things that aren't, right? Like our fear of failure. So it's just such a good book, and I think it just really came to me at such a great point in my life, and so I recommend it to everybody.
That's great. I think that actually ties back to what you were saying about Kamala being a teacher of joy. So maybe that's like being a consumer and then eventual teacher of joy by knowing how to prioritize
Oh, totally.
what you're spending
Totally.
your mind on.
Yes, absolutely.
Okay, and my last question, Sarah, is what is your message for the world?
My message for the world. That's a big question. I feel like that's not something I think about until I'm like, thinking about my tombstone. uh, but I'll try. Let's see. So I think my message to the world is there is nobody who's fearless. There are just people who've chosen to prioritize something else over their fear, right? And so there was never a time where I did something huge that didn't terrify me. Of course, things terrify me, and I think everybody gets terrified at some point in their life. And ultimately, when we kind of are growing and we move on to the next phase of growth in our life, we're going to be scared. And so the way to essentially overcome that fear is just to recognize that there's something that's more important than your fear or than your self-consciousness or than your lack of self-worth, right? And I think ultimately by doing one thing that scares you every week, or every month, that ultimately helps to bring you closer to like the person that you want to be. So that's my message, is just really do things that scare you. And I think that's why in my career I have been able to to do things that some people may think that they need to wait their whole careers to do. But I have been able to do things that were out of the ordinary because I was able to just do something that scared me, and I was able to put the fear aside and say that what I was working on was more important than the fear that was trying to hold me back. So so my message is just do something that scares you, and that something can be as small as writing a piece, or maybe doing something like doing this podcast interview. For some people that might be scary, or just saying yes. And I think just that one word, like just saying yes, or just doing something that scares you once, enables you to do other things that scare you.
Thank you, Sarah, for being here today, for sharing your wisdom, your story, teaching us how not to fear and to take risks. And thank you, everybody who joined us today. You can follow us on Instagram at the Illuminate Podcast. If you loved this episode, please share it with your friends. Leave us a rating and review wherever you get your podcasts. Thanks, and have a wonderful week.